there! Welcome back to our Diabtron channel. Today, we have a truly important topic to discuss: neuropathic arthropathy, also known as Charcot joint. This condition may not be as widely recognized as some others, but it's crucial to understand. So, in this video, we're going to explore everything you need to know about neuropathic arthropathy, its causes, symptoms, diagnosis, treatment, and much more. Stick around because this information can make a big difference in the lives of those affected. Let's dive right in. Neuropathic arthropathy, or Charcot joint, is a progressive and destructive condition that primarily affects the joints, often in the feet and ankles. It's most commonly associated with neuropathy, which is damage to the nerves. Neuropathy can result from various underlying causes, such as diabetes, alcohol abuse, syphilis, and spinal cord injuries. Charcot joint. The term Charcot joint is named after the French neurologist Jean-Martin Charcot, who first described the condition in the 19th century. Charcot joint, also known as neuropathic arthropathy, is a condition with a complex set of signs and symptoms that can gradually develop and worsen over time. These symptoms often manifest in a way that is distinct from typical joint problems. Here's a narrative description of the signs and symptoms of Charcot joint. Imagine you're a person living with Charcot joint, and you start to notice some unusual changes in your foot or ankle. At first, there might be a subtle sense of warmth, almost like a mild sunburn in the affected area. This warmth doesn't match any recent injuries or weather conditions, and it's persistent. As days pass, you begin to feel your foot or ankle swelling, and it's not just a minor puffiness, it's more pronounced, and the size of your foot starts to change. You might struggle to find shoes that fit comfortably anymore because of this swelling. The skin around the affected joint begins to take on a reddish hue. It's not a sunburn, it's not a bruise, but it's there, and it's a noticeable contrast to the rest of your skin. This redness becomes more apparent with time. Now, you start to sense that something is off with your gait. Your foot or ankle doesn't feel stable like it used to. It feels like you're walking on uneven ground, even on a flat surface. You might even notice that you're tripping or stumbling more frequently. The strangest part is the pain. Or rather, the lack of it. You'd expect intense pain with all these changes, but there's surprisingly little discomfort. You might have some mild aching or a sensation of pressure, but it doesn't match the severity of the visible changes in your joint. As weeks go by, the affected joint can become visibly deformed. It's as if the bones are shifting and changing shape right before your eyes, and you can't control it. Your foot or ankle might take on an unnatural appearance, and it can be quite distressing. Imagine living with this condition, where you see and feel these unusual changes happening to your joint, but without the corresponding pain that you would typically associate with such changes. It's this paradoxical absence of pain that makes Charcot joint such a unique and challenging condition to identify. In summary, Charcot joint presents a series of subtle yet distinct signs and symptoms. It begins with warmth and swelling in the affected joint, followed by redness and instability. What makes it truly perplexing is the relatively low level of pain experienced despite the significant joint changes, making early diagnosis and intervention critical for those affected by this condition. In diabetic neuropathic arthropathy, the loss of protective sensations in the joints, combined with repetitive trauma or stress, can lead to injury and damage to the joint without the person being aware of it. The primary cause of neuropathic arthropathy is neuropathy itself. Nerve damage impairs the normal protective sensations in the joints, leading to unnoticed trauma and repetitive stress. Several risk factors increase the likelihood of developing this condition. These include diabetes. Especially when poorly controlled, diabetes is a significant contributor to neuropathy and neuropathic arthropathy. Alcohol abuse. Chronic alcohol abuse can lead to nerve damage and increase the risk. Infections conditions like syphilis can cause neuropathy. Spinal cord injuries trauma to the spinal cord can damage nerves and result in neuropathy. Now, let's talk about the signs and symptoms of neuropathic arthropathy. This condition can be tricky to diagnose because its symptoms can mimic those of other joint issues. Common signs include swelling, warmth, redness, and instability in the affected joint. You might also experience pain that's not consistent with the degree of injury or trauma you've had. Diagnosing neuropathic arthropathy is often a challenge. Your doctor will typically start with a thorough physical examination and review of your medical history. Imaging studies like X-rays, MRIs, or CT scans are essential in confirming the diagnosis. These images can reveal joint damage and deformities that are characteristic of neuropathic arthropathy. Now, let's move on to treatment options. Managing neuropathic arthropathy involves addressing both the underlying neuropathy and the joint damage. The primary goal is to prevent further damage and improve the quality of life. This may involve offloading, using orthopedic devices like braces or special shoes to reduce pressure on the affected joint, medications, pain management, and anti-inflammatory drugs, physical therapy to improve joint function and mobility, surgical interventions. In severe cases, surgical correction may be necessary. Underlying cause treatment, addressing the neuropathy itself, such as managing diabetes or alcohol cessation. Let's not forget about potential complications. If left untreated, neuropathic arthropathy can lead to severe joint deformities, ulcers, and even amputations. This is why early diagnosis and intervention are crucial. Prevention is always better than cure, right? So, if you're at risk due to diabetes or other conditions, it's vital to manage them well. Regular checkups with your healthcare provider are essential. Moreover, lifestyle changes like quitting smoking, limiting alcohol intake, and maintaining a healthy diet can all help reduce your risk. That's a wrap on today's video about neuropathic arthropathy. We've covered the basics, from what it is to its causes, symptoms, diagnosis, treatment options, and even prevention tips. Remember, knowledge is power, and understanding this condition can make a world of difference in someone's life. If you found this video helpful, please give it a thumbs up, and don't forget to subscribe for more informative content. Thanks for tuning in, and I'll see you in the next video.